but it's really critical to get a good handle on now because the manipulations that go with it will depend on your ability to make that palpation. So from here, let's say that we're assessing the right C0, C1 joint, so we're going to laterally flex to the right to isolate that joint. And again, we want to make sure that we're just pivoting the head on C1, so C0 on C1, not laterally flexing the entire neck. That's what we'd like to avoid. So from here, we're going to begin by checking for extension. And in this position, I just have a broad contact on the entire skull. I'm compressing gently downwards, so down along the vertical axis of the body or inferiorly. And then from here, scooping into this posterior movement of the skull, this extension movement. So that's what we're looking at here. And as noted earlier, this movement is typically larger in most of your patients than you'll expect just from intuition. We don't really think about our head being able to scoop backward that far, but it sure does. So make sure to look for those extra degrees of movement and make sure that you're really feeling the end of that end range. So again, laterally flex to the right side to check right C0, C1, compress gently, and then scoop into extension, and then we offer our gentle challenge into that end range barrier. And so just like all of our other motion palpation, we're looking for, is there an elastic end range feel, or is there more of a blocky, impeded end range feel indicative of restriction? So that's for extension. To check flexion, we'll do that similar first step, laterally flex to the side we're assessing, again the right side for now. And now from here, we have our two options. We can have our broad contact on the skull, and we can ulnar deviate the wrist to push down into flexion. We can also use a stabilizing hand at the posterior aspect of the skull and our palpating contact here at the forehead and looking to induce this kind of relatively slight compared to extension, but still following all the way out this flexion movement. So now we're pushing downwards, kind of giving our patients the serious face, the furrowed brow, and that's going to be assessing for flexion restriction in C0, C1. So any questions on these two palpations? Should be relatively familiar, but the key is making sure that you really follow that extension all the way through into its end range and that you're applying enough pressure into the flexion palpation. So if you feel like you're not doing that very effectively with just ulnar deviation at the wrist, then switch to that contact on the patient's forehead and you can have this kind of rocking motion to generate that flexion.
So one more time, we laterally flex to the side we're assessing.
Exactly, yes. So since those two joints are relatively separate, we need to make sure that we're isolating just the one that we're looking at, and that's done by laterally flexing towards the affected side. Any other questions? Okay, so let's break out into pairs.